I'm Luke Schellenberg. I'm an ENT doc. So I'm also board certified in sleep medicine. And so when patients come in and they have severe sleep apnea or moderate sleep apnea and cannot tolerate CPAP, we think about surgical options. I've talked about in another video the problems with traditional sleep apnea surgeries. They're tough recovery, and the research really shows that they have a limitation on how well they can work. So in about 2011 or 12, research articles came out showing that there's a new type of surgical treatment for sleep apnea, what's called Inspire, or a hypoglossal nerve stimulator. I have a little, this is what the device looks like. It looks about the size of a matchbox. It's not very thick. People kind of compare it to who've seen pacemakers, saying, oh, it kind of looks like a pacemaker. Well, it's kind of like a pacemaker. And so it goes in your chest, not on your chest. You'd have an incision and surgically place it there. And it has two leads. One lead goes in right beside your lungs. We used to have a third incision down lower, but now we've actually consolidated that one incision where we have the generator and the sensor lead right around the muscles of the lungs. So it senses when you breathe after you've turned it on at night. And so the idea is that, and then it has a stimulator lead, okay? And so I make an incision up underneath your chin, and it goes up to a nerve that goes to the tongue and the muscles around the tongue, what's called the hypoglossal nerve. I don't have a picture of that nerve, but I have a picture of the tongue. And so you can see the tongue here, and the tongue has a nerve that kind of runs right beside it, right down into the neck. And basically I identify that nerve, and I put the stimulator onto that nerve. And then I basically tunnel a little lead or wire down from that into the generator. From my standpoint, the reason why I think this has already made a huge difference is because it deals with the two major problems with traditional sleep apnea surgery. One, it works in a vastly superior manner. It is not dependent on static change. So if I were to open a door and say I want that door to stay there, well, and the wind could come and blow that door shut. Well, and the same thing happens with our anatomy. When we change the anatomy, our anatomy has a tend to regress down to where it is. You just look at the difference between a 20-year-old athlete and that same athlete 30 years later, they don't look the same. So the same thing happens with our anatomy in our throat, unless we have something that actively stimulated. So you have passive surgery, tough recovery, harder and less successful compared to an active movement of muscles that are stimulated every time that you breathe. So each time that you take a breath after you've turned this on at night, it will stimulate those muscles. And then what it happens is it moves the tongue ever so slightly forward, but it also, actually, I've seen this looking with the scope after it's been activated, other muscles also move. And so if you just think about your airway being a little hole, it widens the hole so that you have more airspace. And you know, success rates, instead of being in the 50s to 70s, this has success rates, not only better, more consistent success rates, but more effective success rates. And so patients that have sleep apnea scores of, 20 or 30 or 40, they're getting them down consistently to less than 10. And that's vastly superior to patients undergoing traditional sleep apnea surgeries. And so I'm a huge fan of this device, Inspire, or a hypoglossal nerve stimulator. Most patients call it Inspire because it's a lot easier and sounds far more marketable. But if you have moderate to severe sleep apnea, I definitely would think about that as an option. But there's certain criteria that have to be met, and we'll talk about that when you come in. All right?